just read a sign that says, please don't adjust the mic. And I've just adjusted the mic. Tēnā rā tātou. Talofa lava, malolelei. Greetings and thank you for being here. And a special thank you to my mother-in-law, Mary, who registered 6 times. So she got 6 tickets just for herself. That's how much she wanted to be here. So it makes me feel really special. I've called this, I've taken the theme of the image of the future and have translated it into a different context. Because in Western paradigms, the time is linear. So time past, time present, and time future. Cyclical. It's connected. And therefore, in order to look into the future, we've simultaneously got to look to the past. Ka mua, ka muri. And that brings us to what Professor Albert Wendt calls the ever-moving present. The ever-moving present for Aotearoa today, for us, is changing. It will increasingly be determined by those who whakapapa to Aotearoa and the wider Pacific. It is an ever-moving present where 1 in 4 babies right now in Auckland are born Pacific. But an ever-moving present where simultaneously this population suffers disproportionately in terms of length and quality of life. And so that poses the important question to us as health researchers and clinicians and community leaders. How do we respond to this ever-moving present? So in this talk, I'm going to present my doctoral research, which reimagines health service and health research by drawing from the knowledge systems of the Pacific. And there's no better place to start than with my family. My father grew up working this cocoa plantation in Samoa with my grandparents. But that's not where my grandparents wanted him to remain. And so they sent him away to pursue the highest level of education that he could. And that sent him to the University of the South Pacific in Fiji, where he met and married my mother, before eventually migrating to Aotearoa. And they were commissioned to look after a growing church community of Samoan migrants in a village called Petone in Wellington. None of these migrants had a university level education. Few had completed their high school education. They had very limited English speaking abilities, and almost all of them had migrated here to work in unskilled, low-paying, and often unsafe factory jobs. But these migrants would become my life's earliest teachers. And they would prepare me to eventually move cities and study at the first school of physiotherapy in Aotearoa and the Pacific at the University of Otago. But here in Dunedin, I was suddenly confronted with feeling profoundly different for lots of obvious reasons. I recall one afternoon, I was going for a walk and I came across a random Fijian brother. We were entering the quad from opposite angles, and it was like a movie, slow motion. We just gravitated towards each other and we gave each other a hug. And we were complete strangers, but it didn't matter because we were just delighted to see another islander. There was this deep sense of the desire to belong. Fast forward to December 2019, when this sense of being different was finally reframed. On the islands of Samoa, there was an outbreak of measles amongst a population that had low immunization coverage, which rapidly escalated into an epidemic. I was assisting in Samoa as part of an emergency medical team, and it was there that I came to realize that the way that I relate and communicate and demonstrate respect and elicit the best possible health outcomes for my patients and their families was not taught solely to me in my undergraduate physiotherapy training, but it was taught to me by my life's earliest teachers. I realized that the way that I approach healthcare delivery was steeped in the cultural values, protocols, and observances of my forebears. This realization sparked the fire in me to contribute these lessons and wisdoms back into the physiotherapy canon, such that it will influence the contemporary health curriculum. And this is what the prominent Māori health scholar Linda Tuhiwai-Smith calls reclaiming space. For Indigenous academics, the battle before us is to reclaim space alongside intellectual traditions that have long enjoyed a privileged position in academia as the seemingly neutral and seemingly benign authority. We as Indigenous researchers and clinicians argue that the intellectual traditions that raised us are of equal validity, rigour and utility in this modern age. And as demonstrated through sustaining our Indigenous peoples and maintaining their health and wellness, as well as the health and wellness of our natural environment for thousands of years. Wrestling with reclaiming this space is critical because there are simply too few of us. And the waves of imperial, positivist, reductionist, and in many cases, frankly, racist agenda has long battered against us. As you can see from workforce data in Aotearoa, only 1% of the physiotherapy workforce identifies as being Pacific. Only 5% identify as being Māori. And this scarcity of Māori and Pacific clinicians only intensifies the further you look up the tree. In over 100 years of the physiotherapy profession in Aotearoa, we have seen only 2 physiotherapists, lecturers of Pacific heritage, only 2 board members of Pacific heritage on our regulatory authority, only 2 Māori who have attained the highest degree available to our profession, and we are yet to see a Pacific PhD in physiotherapy. And so given the profession's wholesale dismissal of Pacific ways of being and knowing, it should come at no surprise then that across the country, Pacific people are simply not attending physio clinics. And when you look at the sports that we play, they are highly agile, high velocity collision sports. And yet physios are more likely to see those who've injured themselves on a trampoline or dancing. So there'll be no dancing today at the end of the symposium. Thank you very much. Well, in other words, physios are seeing the wounded wealthy. This is in the face of the undeniable prevalence or high prevalence of lifelong and life-limiting non-communicable diseases such as diabetes in this case. Also, we're not seeing the number of Pacific peoples relative to the high employment in labour-intensive industries. For us here in Gisborne, that's forestry, agriculture and horticulture industries which operate off the back of this labour force. So why this mismatch? And why so profound and why so long in our history? Dr. Peter Jansen, the medical advisor to ACC, he suggests that, or signals that it may well have much to do with us as clinicians and the environments that we create. That our mainstream physio and health services are simply not viewed as safe places for populations like these to seek help from. An example of this mismatch is the current model of care developed by Physiotherapy New Zealand. The person and whānau-centred care model, which might be a bit hard to see, but it's a glorified rainbow that is very difficult to implement into practice. And to which one of my research participants said, it's not a Samoan model. And so in my doctoral study, I've sought out to explore how understanding Samoan cultural knowledge can enhance the engagement with Samoans specifically and Pacific people more broadly, so that they will access the best of what our physio services have to offer. We deliberately decided to focus on Samoans for many reasons, but primarily because Samoans make up the largest proportion of Pacific people in Aotearoa, almost 50%. I utilised Pacific research methodologies to interview people both here in New Zealand and Samoa, and utilising both Samoan and English languages. To Samoan families, I asked them this: what has been your experience of physiotherapy in New Zealand? And they said, it's a one-size-fits-all model. It's a model that prioritises bums on seats and doesn't value the time that it takes to build relationships and let alone build trust in order to disclose important and sensitive information. To my colleagues, my physiotherapy colleagues, I asked them, what does best practice look like for us working with our people? They said, best practice looks like engaging the whole family. It looks like demonstrating respect, particularly with our elders. And they also described the Samoan concept of te uleva, which means to nurture the relational space. They said best practice looks like being a good host in your clinical environment. It looks like enabling conversations to head towards matters of faith and spirituality, because that will engender trust for most people. And in spirituality, they're also broadened to encompass having a shared sense of humour, having this elevated sense of connection. And then lastly, Best practice looks like utilising native languages where and as possible. They mentioned that demonstrates valuing the person in front of you, and it also values the ancestors that that person may be named after. So name pronunciations matter. Every family I spoke to, they referenced the traditional healer as their reference for physiotherapy. And so that triggered us to ask, well, what could we, as Western trained practitioners, learn from the traditional healers? The families in Samoa in particular, they said traditional healers, they already operate at that best practice level. They already engage families, they already nurture the relational space. And they also talk through their diagnostic process in a form, in language form that people can understand. They also always provide therapeutic touch, and often in combination with our natural oils available in our environment, particularly coconut oil. That whole experience calms the sympathetic nervous system and creates a safe space for our people. But these families also noted the limitations of the traditional healers, in that they are trained through apprenticeship, and therefore they don't receive the anatomy and pathophysiology training that we do. And therefore they're at risk of missing red flags and prolonging recovery. They also noted the two most common reasons why Samoans do not or cannot attend physiotherapy clinics. Firstly, because of a lack of understanding around health management, a lack of education. And secondly, because the cost of seeking transport and then paying a co-payment is simply unfeasible for families who live on or very close to the poverty line. So that brings us to this ever-moving present. One of the outcomes of my study was to propose a new model of engagement constructed from the information generously shared by my participants and based on the traditional Samoan dance called the tawalunga. The tawalunga is the culmination of any celebratory event. It's the dance to end all dances. Traditionally, it would be centered around the maiden of the village, pictured here, known as the taupo. She was often the daughter of the paramount high chief. And the successful outcome of any tawalunga is that the taupo can perform her ancestral dance unimpeded, and that the whole family is honoured in the process. Let's see if we can watch one. There's our taupo. There's a small Samoan man who's into the picture. So I want you to keep an eye on the man with the traditional tattoo there. Also note a man with a red shirt. And we also note how everybody surrounds in a semicircle fashion. They surround and orientate themselves around the taupo. It's a gentle gift. Ladies and gentlemen, is a tawalunga. So culturally, the tawalunga model depicts 5 characters. The man who's in the red shirt at the back, he's a high chief. He's a Mātai. So he represents the chiefly social governance systems that all Samoans connect to through genealogy. The man with the traditional tattoo is an aiuli. And the aiuli's role is to clear the environment and prepare the environment. They surround and protect the taupo, and then they dance as vigorously and as skillfully as they can to bring honour to the occasion. They maintain a respectful distance, as you would have seen with the taupo, but as you would have seen with him, his eyes never left her. This person at the bottom left here in the orange circle, in the days before electricity, they had the role of keeping the fire burning so that the tawalunga could be visible. The longer that they could keep the fire burning, the longer the tawalunga could last for. So they had an important role. And they were known as the au muafi. When we translate this into the clinical context, the tawalunga model positions the taupo as the centre, as the patient. All eyes are on her. The focus is on enabling her to perform her role and function in their dance and in our families and society unimpeded. The physio and family members and any health professional really are positioned as aiuli. They're there to protect and to serve the taupo. And although they're on the margin, as you would have seen in the video, they're not passive. They're dynamically and actively involved and interacting with each other and the taupo. The muafi and the orange circle here represents the important role of policymakers. So many of you in the room, managers, business owners, university educators, those who, like the omuafi, work busily in the background, but to illuminate this clinical interaction. The better that you can keep the fire going, the longer and the better, more clarity that this clinical interaction has. And as mentioned by the participants, best practice involves the to nurture the relational space. And so it poses a question to us as a community. How do we nurture the va? How do we nurture this relational space, particularly for Indigenous peoples and their cultural, intellectual traditions? Well, sometimes nurturing the space looks like providing opportunities to speak to wider audiences. Sometimes it looks like encouraging Indigenous students to redesign models and systems, and I'm really excited about our interns in that respect. Sometimes it looks like excitedly greeting a colleague from across the campus. And sometimes it looks like fostering learning and healing environments that are welcoming and that remind us that we belong. And that's certainly what I found here in Mātai. As a result of those who have nurtured the va for me along my journey, I have the privilege of standing here in front of you on this cutting-edge symposium. I had the privilege of holding New Zealand's vote at World Physiotherapy General Meeting in Dubai earlier this year. I have the privilege of being appointed by the Minister of Health to the Physiotherapy Board. And by this time next year, I will be the first Pacific PhD in physiotherapy. Sorry for that. But I didn't do it alone. I had significant tangible support from my life's earliest teachers and my life's latest teachers. And so I'd like to thank Samantha and her family, Peter and Dame Bronwyn. Peter's pictured here drafting my family and I down the sheep run. Thankfully, he didn't have his docking gear on this day. But also to acknowledge Lee Potter, Patrick McHugh, who are my academic sort of mentors here in Te Rāwhiti, and also to acknowledge that without Mātai and Samantha putting a case for me, there's a really high likelihood that I would have to uproot my family and head to Dunedin to do my PhD, so I'm so ever grateful to be here. Nō reira, tēnei te mihi atu kia koutou, tēnā koutou, tēnā koutou, tēnā tātou katoa. Tātai.